Well, I basically find out what they want to truly achieve. I mean, what their goals are. Do they want to look better in clothes? And then they're fine. Or do they want to be out by the pool in a two-piece bathing suit? Because that's really determines on what, one, what the procedure and what needs to be done, and also what their issues are. For tummy tuck or liposuction, again, the biggest, I think, determiner is skin. If you have excess skin, you can liposuction and smart lipo, but if you have truly a lot of excess skin, it's not going to take it away. And so that pushes you into a procedure for that will address this excess skin. Between tummy tucks and body contouring and liposuction. Um, there's liposuction that you can contour the body and take down kind of excess fat. People who are candidates for tummy tucks, you start talking about issues with excess skin. People who have loose skin. Obviously, liposuction won't address that. Even smart lipo, it will help, but it's not gonna. It doesn't take care of the loose skin to that degree. It has to be removed, and that's pretty much when you start talking about tummy tuck. So, skin issues, excess skin, and obviously almost any woman who has had a child is a candidate for a tummy tuck. Now, whether they've had loose skin or not, that's part of it, but they have abdominal wall laxity. And what happens is that six-pack muscles in midline, when they become pregnant and during the pregnancy, those muscles separate. They get stretched out and they don't come back. So even though they lose the weight afterwards, they'll still complain of a little laxity, a little pooch, especially below their belly button, because that's kind of where all the stretching had occurred. So those patients are really good candidates for tummy tucks, or what sometimes we'll call modified, in which we don't go up above the belly button, because I always tell my patients about 60% of the benefit of a tummy tuck is really not so much taking out the extra skin. That's kind of just frosting. It's actually tightening the muscles back in midline, and that's what gives them the flat stomach again, that washboard-like abdomen. Men are a little different, though. They obviously don't have children. A lot of men gain their weight inside, kind of what we call visceral fat, or not on the outside, not even where you can get to it with liposuction, and that gives you that distended, bare belly or whatever. And when they lose that, in a lot of ways, it is almost like a man having a pregnancy, that the muscles have stretched out, and so in those men, it's they see great results because I tighten the muscles back. Also, when they start working out their abs again, they start seeing definition. Whereas, for example, if those muscles are not in place, it'd be like, for example, me trying to do a curl and work my biceps and my biceps over on the side. It's just not going to be efficient, and you're not going to see the definition. Once they get back into position, you start seeing a lot of results, a lot more definition. I do a lot of what I call etching. And that's fine liposuction. I mean, we're talking taking body sculpting and then refining it even more. And these are men and women, some women, who are thin and trim and they work out, but they don't see that definition they want. And I can actually go in there with a fine cannula, liposuction cannula. Sometimes I'll use the smart liposuction cannula and go along the muscle bellies. And so when they heal, they actually have definition of the muscles. It's almost like getting a six-pack without working out.